Hi, my name is Rory McGoldrick. I am a board certified plastic surgeon working for Dubai Cosmetic Surgery. So patients present for breast augmentation for any number of reasons. After pregnancy, with age, or any number of other medical problems can lead to weight loss, which leads in turn to a loss of volume in the breasts. Also, patients may present with naturally small breasts or medium-sized breasts just seeking an enlargement. Now, breast augmentation has a number of techniques. Most commonly the breast implant is used, but also more recently autologous fat transfer, or using your own tissue, your own fat, in order to augment the size of your breast is becoming a technique of choice for many surgeons. Performing a breast augmentation using fat transfer from liposuction is very different to using an implant for breast augmentation. The fat transfer quite often requires a number of stages. At each stage, the degree to which the fat survives is the main determinant of how many stages there will be. When a patient requests a breast augmentation with using their own tissue in the terms of a fat transfer, the first stage is to assess as to whether there are adequate donor sites for the fat to be harvested, i.e., do you have enough fat to be liposucked, processed, and then used as a natural filler in your breasts. So our first step in the assessment is to look and make sure that you have adequate tissue, normally around your abdomen or flanks, and sometimes in the inside thigh. Breast augmentation using your own fat is becoming increasingly popular. This technique involves liposuction of any unwanted fat, normally around your waist, your flanks or your thighs, which is then processed and made more pure for injection into the breast tissue. One of the disadvantages of using fat to augment breasts is it normally takes a number of stages, but if you're willing to undergo these stages, you have a long-lasting breast augmentation with natural results that will change size in relation to your body size. Traditional methods for breast augmentation involve using implants, but a more recent development has been to use your own fat after liposuction. Our first rule in breast augmentation is to create a beautiful result which looks natural. This can be achieved either through implants or using your own fat after liposuction. Primarily worldwide, implants are used for breast augmentation. Broadly speaking, there are two different types of implant. There's a teardrop or an anatomical implant, or a round-shaped implant. Again, worldwide, the round-shaped implants are most popular, especially if the patient has a natural-looking breast to start with and only wants to have a larger breast. Patients presenting with more droopiness or ptosis, or what we call a constricted lower pole or tuberous breast deformity, are more suited to an anatomical implant. When assessing a patient for a breast augmentation, it's critical to look at the anatomy of their chest and to have an aim to create a natural, beautiful result. In order to do that, the chest wall measurements need to be obtained, including the width of the breast. The implant type is then chosen. It is then critical to assess the amount of breast tissue that the patient has to start with, because this will determine as to whether the implant lays just below the breast gland or above the muscle, or actually underneath the muscle. The most common scar that you see from a breast augmentation is the scar in the fold underneath the breast, but other options include around the nipple or from the armpit. Common problems that patients ask about with regards to breast augmentation are how soon after their breast augmentation will they need to exchange the implant. Very often 10 years is discussed, but really in reality this is unlikely. The main reason why you would remove an implant if you needed to was if there was a problem. The main problem to remove an implant is either due to capsular contracture, which is a scar-like contraction around the implant itself, It's nothing to do with the breast tissue, it's the body's reaction to the implant. Or there is a rupture of the implant. Year on year, there's approximately a 1% risk of rupture. So at 10 years, 90% of patients are happy and problem-free with their implant.